surge in COVID cases is forcing some healthcare workers to make unimaginable decisions over who gets life-saving medical care. Many in the hardest hit areas are exhausted and afraid, and their hospitals now running out of room and resources. Megan Fitzgerald reports.
Tonight, hospitalizations across the country are facing a crisis like they've never seen before.
It's a feeling of dread because we know what is coming.
The country setting a record for hospitalizations on Friday, the fourth day in a row, over 60,000. In just the last month, COVID hospitalizations in Illinois have nearly tripled. ICUs are quickly approaching capacity. Medical workers scrambling to keep up with the surge, and doctors like Michelle Prickett say healthcare workers are at a breaking point.
Everyone feels like they ran a marathon and now we're being asked to do an Ironman, and we're just tired.
Hospitals across the Midwest are being crippled by COVID. In Wisconsin, doctors and nurses are now forced to prioritize care, and they're running out of beds.
I never thought as a healthcare provider that I would be in the position of trying to decide who gets life-saving medical care and who doesn't. That kind of stuff isn't supposed to happen in the United States.
Hospitals under strain from coast to coast. In Pennsylvania, an elementary school gymnasium is now ready to be an overflow hospital. In Montana, health officials say they don't have enough staff to support rural populations. Utah healthcare workers overwhelmed by patients are forced to activate their surge plan, calling on New York nurses they helped in the spring to help them now during their darkest days.
A battle is easier won together, and it is the circle of trust and support that has kept us going.
Nurses are now begging the public to help them, asking the country to cancel Thanksgiving plans.
We didn't sign up for an unknown pandemic with limited resources, and it's very selfish to make that decision when there are people working really, really hard to keep you safe.
A warning from the front line that quarantine fatigue doesn't compare to the exhaustion inside the ICU.